Now, Dr. Ashish Jha, the Dean of Brown University School of Public Health. Dr. Jha, thanks very much. We have an NBC News analysis finding that if the coronavirus infection rate keeps going at this current rate, the U.S. could see some 20 million cases of COVID-19 by Christmas. Mayor Lightfoot, of course, calling on people to cancel their Thanksgiving plans. What do you see as the way to get the country back on track and deal with this surge?
Andrea, thank you for having me on. We are undoubtedly at this point in the worst phase of the pandemic. I don't think we've ever had as much infection in our country as we do right now. And it is heading in the wrong direction. And as opposed to April and May, where we could look to the summer to give us a break, we are not going to be able to get a break anytime in the next couple of months. My expectation is that at least 100,000 people are going to die between now and Inauguration Day if we don't get our act together. We know what to do, right? It's all about indoor gatherings of people when they're not wearing a mask. I just don't think that we can afford indoor dining and bars. I don't think people should be having other people over for dinners. I have canceled our Thanksgiving plans with our extended family, and we're just going to do it as our immediate family. It's hard to overemphasize how bad things are. Hospitals are filling up across the country. We have to take this much, much more seriously. One last point is that Congress has to act. Congress has to get money out to states and to businesses so people can get through the next 6 weeks. If Congress continues to fail to act, we're putting people into very difficult choices that's going to lead to a lot more deaths.
Which gets the economic pressure. Bars, restaurants, those people need help now and more testing. Dr. Vivek Murthy, who is the top advisor on the task force for Joe Biden, said this morning on ABC that we should be thinking of these new orders like a series of restrictions that we dial up or dial down, like what Mayor Lightfoot is doing, depending on just how bad the spread is. Let's play part of that.
In New York City, for example, what you're seeing is them target their interventions down to the zip code. So we're not in a place where we're saying, shut the whole country down. We got to be more targeted. If we don't do that, what you're going to find is that people will become even more fatigued. Schools won't be open to children, and the economy will be hit harder. So we've got to follow science, but we've got to also be more precise than we were in the spring.
Do you agree with him that these lockdowns or rollbacks can be targeted?
Absolutely. And, I wrote a long thing about this last night about how the two states that I think are doing this right are New York and California. They both have really ramped up testing, and all of their policies are incredibly targeted down to zip codes or counties. That's the right way to do it. No one needs to be talking about a national lockdown. I just don't think that's either necessary nor helpful. But if we don't do the targeted policies, we're going to see our hospitals really get into trouble. So I think there's a way out of this if we are smart and we're proactive. Just doesn't seem like there's a lot of political will right now to do those things.
I just want to also point out that the Washington Post is reporting that more than 130 Secret Service officers who travel with the president have recently been ordered to either isolate or quarantine because they either tested positive or were in close contact with an infected co-worker, which is another cost, a terrible, terrible human cost of those rallies and all of his travel running up to the election.
Yeah, the White House has been a hotbed of infections, largely because they have thrown in the towel. They're really just not doing any of the things that we know are necessary to protect people. And it's one thing when the president gets infected. Of course, he can get world-class care, and that's appropriate. But of course, all the people who work around him, the Secret Service agents, these are men and women who've dedicated their lives to our country, and they deserve better than to be exposed to a virus where the infection is preventable, just because people are not willing to do some basic public health measures.
They, and of course, their families and friends as well. Thank you so much, Dr. Jha. It's always great to have your expertise.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.